Senator, let me also...
They've already pulled the trigger, and I am not for supporting 5 more years of these health insurers are ripping off the American public.
But it's going to be at least
Senator,
5 years before the bill is implemented.
The co-payments, the deductibles, not insuring people with pre-existing conditions, they've shown us what they care about. You have the president of Aetna making $24 million a year, and the 10 top insurers, all of their CEOs are making over $10 million a year. We can't give them 5 more years of this. We need credible, comprehensive, universal health care with a good, robust public
but
option
they don't need
now.
to wait for the full 5 years. So.
Let me also bring up the other question that the
Yes.
Congresswoman raised earlier, Senator, with you, in part because there's precious little yet Republican support for what the president has called for. The Democrats are considering this reconciliation option, which would be Democrats trying to pass it on their own with a majority vote. What would be the impact of that?
Well, and maybe I don't understand people, but I've always felt that if it's bipartisan, Democrats with Republicans and Republicans and Democrats, it's going to have a lot of credibility, particularly if it's going to be sort of the president's bill. And the American people know if Maxine and Mike are voting for this bill, it must be a pretty good bill. Or if you've offended every interest in town, it must be a pretty good bill. And I just think it just elevates everything 2 or 3 notches. And I think the American people say, well, if Tom Daschle's for it and Mike Pence is for it, name 20 or 30, I'm an optimist. I still think we're going to get a lot of Republicans to vote for final passage if it's a reasonable bill. Now, we're not going to
Even if it includes the public option?
Oh, I wouldn't go that far. But,
Good. With all due respect, you are one of the most respected members of the United States Senate, having served with great distinction, and you can't get Republicans to support a credible health care reform bill.
I'm working
They're
on
not
it.
going to do it.
Well, I mean, but we've really seen this pattern from the beginning of the year. I mean, they passed a so-called stimulus bill that was without any Republican ideas.
3 Republicans in the Senate.
Budget-busting budget. They passed cap and trade on virtually a partisan basis. Now they're driving through this government takeover of health care. I really think the American people, at least the town hall meetings I had, George, many Americans feel that this federal government is spiraling out of control. They want to see us take a half step back and figure out how we can lower the cost of health insurance, lower the cost of health care, have a strategy for energy, put our fiscal house in order. And yet what they see is, with all due respect to Maxine, what they hear is, well, they're not working with us, so we're just going to do it on our own.
Let me bring that to you, Senator Daschle.
You've had your opportunity. You don't have a bill. Where's your bill? What have you come up with? What are you offering as an alternative? This president has reached across the aisle. He's done everything. He's stroked, he's cajoled, he's begged, but the Republicans are not supporting him. It's bigger than health care. It is about President Obama, and the Republicans have decided to use this by which to bring him down.
I don't believe that's true. Maxine, I don't believe that's true.
Well, I believe it's true, and it's been said.
Republicans have a number of bills. We have a broad proposal developed by Congressman Roy Blunt. We're talking about, as I described before, allow Americans to purchase health insurance across state lines. Let's bring about malpractice reform to end the era of defensive medicine. These are all ideas we're willing to bring to the table, but we don't want a government takeover of health care paid for with $800 billion in taxes.